You are watching the Doc Talk Show. In the doctor's room with Dr. Shiraji discussing lower back pain.
I'm Dr. Sharad. I'm working with UMC Hospital. Coming to the low back pain is the most ubiquitous health problem, a health issue that we face. And there's a price we pay for being bipeds because we walk on two legs. It is the second most common disease after common cold. Having said that, so like a common cold is the first commonest disease in the world, back pain is the second common. Entire surgical specialty is focused on treating back pains in a surgical way, but almost very few people, almost I would say in my experience of 22 years, only 10 to 12% of the people who actually have back pains and who have an organic and pathological disease need surgery. Almost 60% of the back pains that are there, that we face in our clinic, are mechanical back pains. So what do we mean by mechanical back pains? Mechanical back pains are the back pains which a patient suffers because of the wrong mechanics of the body usage. Now I'm using the word body usage. If a person is standing straight, the spine is made, if you have to see the spine, now the spine is made straight here. So the spine is primarily made for bearing weight of the body in a vertical angle. So if for any reason, as long as my body is working in a straight line, in a straight posture, the biomechanics work very well. The weight transmission, the center of gravity does work very well. Now, studies have proved that the weight on the spine increases by 70% if I am sitting without a back support. A simple fact that I'm sitting without a back support increases the stress on the spine by 70%. And if I have to add that bending the spine from the waist down increases the stress on the spine by almost 200%. Obesity, cigarette smoking, alcohol, lack of exercises, these add to another 20-25%. So now what causes back pain? Now back pain could be because of mainly, I'm saying mainly, there could be a lot of reasons, but mainly for you to understand could be because of three reasons. Number one is disc prolapse. This disc gets worn out or gets bursted and the disc material shifts behind and either compresses your nerve roots or your spinal cord, which is there behind. Now the third type, commonest type, is called as canal stenosis. Canal stenosis typically is a disease of old age. Now for all reasons, this brain is your generator which is going to generate electricity. It passes through the spinal cord and then the same electric current is passed out through the nerve roots and which are going to supply your muscles. Nerve root remains compressed for a longer time. The muscle, the part of the leg or hand which it is supposed to supply starts getting weaker or in a way gets paralyzed, but it is restricted only to that nerve root. That is the time when you start losing power in both legs. You lose the control over your urine and you lose the control over your bowels. Patient starts passing urine without knowledge, patient starts passing stools without knowledge, and that is a surgical emergency. Now having said that, as I said earlier, most back pain cases or even most discal diseases can be treated conservatively. There are only few cases where we have to actually go in and do a surgical intervention. So now what next? You had the history of the patient, you examine the patient, so now what do we do next? The next we do is investigation. Now the basic investigation of the spine still remains an X-ray of the spine. It is still a gold standard of all investigations of spine. Once I'm convinced with the X-ray, then I have two choices to do to go further. Either I do a computed tomography, that is called as a CT scan, or I do an MRI. Most commonly MRI is done because MRI gives you a better picture of the spine. We do an MRI for two reasons. Number one, to confirm the diagnosis, and number two, depending on that diagnosis, come up with a plan, a treatment plan for the patients. Different patients come with different kinds of pain. Like some patients come with radicular pain, some patients come with a neurogenic pain. We correlate three things together: patient's symptoms, my findings, and investigations. All three have to come together for us to take a decision on a spine surgery. Patient can have either of the two symptoms: one, pain, or he can also have a neurodeficit. By neurodeficit, I mean that the nerve root has been compressed for a long time and that muscle has started failing and it does not work anymore, or has become weak. There are very few absolute indications for surgery. One remains cauda equina syndrome, where there is a gross neurological deficit, there is a gross loss of control over urine and bladder. If I have to sum up the treatment, there are three treatments. One is conservative, one is surgical, and there is something midway that we call as epidural steroid injections. So what do conservative management include? Conservative management include medications, physiotherapy, change of lifestyle, a few exercises. Having said that, we work here every day. We have a hotline, we have a front desk number. If you have any troubles, I would be more than happy to help you. I always welcome any queries, any questions you have, and I will do my best to answer every question of yours. Thank you.
You are watching the DocTalk Show.